welcome everybody to today's launch. I'm really pleased to have you all here, and suppose today is the culmination of quite a journey that we've all taken, which took the form of many cases of emails and phone calls and what have you, gathering together some information. And like I say, today's the culmination of that, where we will formally launch the Cheshire and Merseyside Public Health Research Hub. We've purposely called it that and not a collaboration in order not to confuse it with the various other collaboratives and collaborations in place. So I am going to sort of stop talking for now. There's a lot more of information that we will share during the course of today, and I hope you'll really enjoy the session that we've got planned. So what's next?
Ifeoma. Thank you. It's me next, Ifeoma. So welcome everybody. I reiterate what Ifeoma said. My name is Mari Davis. I facilitated the session that we had in December, which people seem to enjoy. It's going to be a similar sort of format today. So in the agenda, we're going to start off and we're going to hear from Ifeoma and Nia about what's happened since December, and they're going to fill us in on the work that's been done. And then we're going to have two sessions, which is the bulk of the meeting today, really. In the first session, Dr James Morris and Dr Maja Palmer are going to talk to us about the PHIRST offer, and so the Public Health Intervention Responsive Study team's work and what that might mean for us. So we're going to have time for some questions and answers about that approach. And we're also going to have a breakout session where you have a chance to discuss in your places, in your local authority area, with some academics, what you might be interested in terms of evaluation. So we'll bring it down to a practical level of what can we do, and then we'll hear some feedback. That's the second session. Session 2, we'll give a break as we normally would for 10-15 minutes. And then session 3, we're going to hear from Dr Jade Thai about possible collaborations in Cheshire and Merseyside and her perspective on that, and hear some exciting ideas from Jade. So thank you to Jade, and again we'll have time for conversations and breakout too. And then finally we want to pull it together at the end, work out what we're each going to do, what we can commit to, and how we take this network forward. So exciting afternoon, and just overall the format seemed to be a winning formula last time is hear from some speakers who are familiar with the area, then do some breakout work, brief feedback of 1 minute per group, and each group having a group facilitator. So at the next slide, we found the things that helped us to work together last time was to be on silent mode, not to repeat what any individual has said during the meeting, but actually to report on ideas rather than people. Stay muted. I can see everybody is. Do put your hands up, and if you can't be seen, then just shout, and we'd love to hear from you. We're going to use chat, so please start the chat going. You might want to start in a minute and say hi to each other. Put your name on if you can, so that we can see who's here. So you've got a rename button on Teams. So I can see Pete's come up now. Pete Stephen, great. Put your name, or Stephen Peters, put your name down as you want to be addressed. Video on is preferred. It's good to see some faces. And really, if you possibly can, switch off your email, switch off your WhatsApps, and fully throw yourself into this afternoon. So I'm going to hand back now to Ifeoma and Nia, who are going to talk us through what they've done since December. Over to you guys.
Thanks a lot. So over the course of today, we're going to really just describe pretty much what brought us to deciding on having the hub, and a little bit about, if you like, the journey to the hub, and then tell you what the hub will do. So I think it was probably something like the 1st of December. We're just at sort of peak Omicron when we had the first workshop. We had decided that we needed to really focused, if you like, on some of the areas that had already been identified by previous research done by NIHR that identified what the barriers to research in local authority public health teams were. And for those of you perhaps that weren't there, some of these might include a lack of training, knowledge, skills, something about culture and attitudes, as well as some of the other things that obviously, resource being perhaps the key one. So we looked at things around what we could do to resolve that. And some of the things that came out loud and clear was that we needed to not just focus on public health teams themselves, but reach out to academics, reach out to the voluntary sector, as well as the community. But we also identified some of our strengths. So things like the fact that public health teams had easy access to the community. And indeed, we were, if you like, not only able to do research, but actually to make sure that that research was implemented on the ground. So it also became clear that for us to do that really well, we could do it collectively, working through CHAMPS, a model that's been in place for some time, and really, if you like, get solid ground in working together. So we agreed that the next thing to do was actually to pull together this hub, but to be very clear about what the hub could and should do. And much of that was about linking us all together and to cover some of those areas where we thought there were weaknesses. So that's really where we are today in terms of what we got out from that workshop and our decision to move forward to the hub. So if we just look at the next slide, that actually starts to tell us, if you like, what we've done since that workshop. So pretty much we're here today to launch the hub, which is what we said we'd do. So if you like, you can put this in your diary. I was there the day that we launched the hub in Cheshire and Merseyside. And I've pretty much said what it is that we want it to do. The form it's going to take, it's going to be online predominantly. So there's going to be a website where we pull together a lot of the information that you've said to us you want to see. There'll be opportunities to get involved in research, to identify research funding, identify training that you want to have as well. And added to that, we're going to have a number of meetings over the course of the year where we bring together, again, public health teams as well as academics and share learning, etc. There's so much I want to tell you, but I've been told I've only got a very small time. So hopefully over the course of today or this afternoon, we'll find out more. The other thing, though, is that there was an opportunity that we had to get to come together to form a HDRC, which stands for, oh dear, Health Determinants Research Collaboration. It was an opportunity to get up to £5 million from NIHR. So a group of us came together to really start to pull together to create this collaborative. Now that happened in November, just prior to the workshop. We weren't successful in that bid, but we learned such a lot from it in terms of gathering all that information that we really decided that absolutely this was the way forward for us as a collective. And if you like, in many ways, the idea of the hub was born from there. The final bit that came out, though, was about research champions and the need to actually have, if you like, a person who could sit in each individual public health team and in reach, share information into that team, as well as come more formally together. We think there's advantages to this champions model because that individual, well, we're currently exploring this, but that individual would hopefully be linked in with an academic institution, and we're looking at developing honorary contracts for them to strengthen that link between, again, the public health teams and the academic institutions. So hopefully that's something, it's more than just in development, and hopefully in the next coming weeks, we'll be able to send you out some more information about that. I've talked a lot. I'm going to hand you over to Nia because she's going to describe some additional work that we've done. So Nia?
Thanks, Ifeoma. Yeah, I'm Nia. I'm the researcher working on this work with Ifeoma based at Lancaster University, and I'm funded by CRN Northwest Coast. Just going to reflect on a couple of extra things. So one was around the public involvement, and so those of you who came to the workshop in December will know that the initial bit of work we were doing was focusing on building the relationships between academic and public health staff. And the public, involving the public and communities was sort of on the periphery. But there was a real lot of enthusiasm for that in the last workshop, so we've been sort of exploring avenues for that. The issue we have really is that we don't yet have a clear picture of what patient, public and community involvement and engagement looks like across our region. And from talking to various people, I got talking to Paula Wheeler at ARC and the NIHR at Lancaster, and along with Professor Jenny Pope, they've got a small pot of money to look at doing a mapping exercise across the whole Northwest Coast. So as part of that, I'm going to be contributing in looking at doing a mapping exercise of what we've already got in terms of PPIE within Cheshire and Merseyside. So that's going to be a really useful thing to, information to gather. What I would say, while some of you are here today, if you are aware of any of this sort of good work that's going on in the region, or if you know of someone that would be good for me to talk to, please do let me know. You should have my email, or I'll pop it in the chat. The second thing is around the actual doing some involving members of the public in the kind of funding and support we need for that. And we're in discussions at the moment with the CRN. So I've seen Greg Woodley, I think, is here today. So we're continuing conversations, and hopefully we'll be able to update you on where we are with that in terms of involving people and communities in the hub and in the research that follows, hopefully. The next part to just give you a bit of overview of is the research. So really this is quite a small pre-post study. We just want to make sure we have some measure of the impact of the hub and the sort of work that we're doing on the research culture, which is the main of my job, sort of the increasing research culture in local authorities. Could I have the next slide, please? So just very briefly, really. So at this point, this is just for local authority public health staff only. So we're aware that most academics have research as part of their roles, and this is more about people who are currently not research active. We are currently awaiting ethical approval. Hopefully it'll come through any day. But this is going to take the form of 2 anonymous surveys, one which was supposed to be before, but will be kind of at the same time of the launch, so hopefully in the next couple of weeks, and then one in about 6 months' time. So those of you who came last time will have heard me talk about, we've based a lot of our work on the COMBI model. So it's really looking at your capability, opportunity and motivation to be able to do research or translate research into practice. So there'll be a short questionnaire measuring those elements of that model. So you'll receive an email directly from Champs from the admin team, so it won't come directly from me, so that this remain anonymous. You'll just have a link and that'll take you to an information sheet, a consent form, and then a brief questionnaire. Hopefully it won't be too onerous, and we'd really love for you to take part. As I say, you'll get another link in 6 months' time, and then hopefully we'll be able to see, compare those and get an idea of what else is needed going forward to kind of keep going with this, building this research culture. Thank you. I think that's everything I've got to say on that one.
Thank you very much, Ifeoma and Nia. You've been certainly very busy in 4 months. Thank you both. And great, thank you to you all for using chat as well. I think it's really helpful to introduce yourselves this way because you're not getting to everybody share their voices. So just to give us all a chance to use chat, what I'd really like you to do is just put in chat, given what you've just heard from Ifeoma and Nia, what really excites you about today's launch? We can hear the excitement in their voices, I can tell. So please just write a sentence or two in chat, no more than a minute, and then let's just hear a couple of voices. You've all got the chat function. What excites you? Why are you? Might be the speakers you're going to hear. Chance to work in your place. Are you all writing in chat? That's why we're not seeing it appear. Yeah, Jen, thank you, Jen. That's great. They're coming in thick and fast now. Steve Peters, would you like to say, just briefly tell us what excites you? You said you might want to unmute yourself if you're happy to talk.
Yeah. My previous sector was sport and physical activity, and I was actually involved in the European Sport Development Network, which was basically a network of researchers and practitioners. So it's very similar to the aims of this, and I was sort of part of the steering group for that, and you know, that was a really useful mechanism. So to have that in my sort of new role within public health and the opportunity to have real world challenges presented to researchers to work on, and then use that evidence to inform practice is really exciting.
Lovely, thank you, Steve. And I'm just going to choose Emma Halliday. Would you like to tell us, you said you'd like to learn about evaluation interests of other local government colleagues. So what are you thinking?
Sure, yes, well, we're about to hear about the new PHIRST scheme, which I'm involved with. So as a newly appointed member of the PHIRST team in Lilac, we're really interested to hear about the sorts of initiatives and supports that local government is looking for, particularly for evaluation.
Lovely, thank you very much indeed. And Paul Atkinson, would you put your thumb up in yours, which is great. So what's your thoughts about excitement?
Oh, well,
I'm choosing randomly here, Paul, so just give us a sentence if you feel like it. If not, I can move on.
I'm an academic. I'm interested in grounding what I do in the health needs of the real world out there, and not just in what I think is important.
Yeah, thank you. And thank you to those of you who've just spoken up. Do read through what people are saying here, because I think it gives us a real picture about what we want out of this, and that connection between us as academics and as public health, which is vital. So thank you for all writing in chat. So I think we'd like to go on to our first group of speakers, really. So we're going to start to think about evaluation and the work that PHIRST are doing. And Dr James Morris and Dr Maja Palmer are going to do this session with us to start with. So I think, James, you're going to do most of the talking. We're thinking about 10 minutes. Is that what you're thinking? Or
yes, about 10 minutes, and then time for a few Q&A, I think, as well.
Lovely, great. So we'll listen to you, and then do be surfacing your questions. Write them in chat if you like, but we'll give you a chance to actually voice some questions to James and Maja. Go for it.
Thanks, Maury. And so good afternoon, everyone. And thank you very much for inviting us to give a talk this afternoon. Really good to hear about the launch of the hub. So my name's James Morris. I'm a consultant in public health medicine at the National Institute for Health and Care Research. And as you say, we've also got my colleague Maja Palmer, who's a research manager also at the NIHR. We're both based in one of the coordinating centres in Southampton, but we work nationally on the PHIRST programme. So the aim of this talk really is just to give a brief overview of the NIHR and also of the PHIRST initiative, and then to dig into some of the practicalities in terms of local authorities applying to the PHIRST programme. So Tracy, if we could have the next slide, thank you. So a little bit of background, first of all, on the National Institute for Health and Care Research. So we're the nation's largest funder of health and care research, complementing other research funders such as the Medical Research Council and other bodies, be they charities or third sector. And we provide the people, facilities and technology that enable research to happen and research to thrive. The mission of the NIHR is to improve the health and wealth of the nation through research, and we're funded through the government, through the Department of Health and Social Care. And interestingly, actually, the NIHR recently had a name change, adding the "and care" to partly to bring us into line with the Department of Health and Social Care, and to kind of reflect the fact that it's important that we're funding research not just in the purely medical sense, but in wider areas as well. Next slide, please, Tracy. Thank you. So within the NIHR, there are a number of research programs, one of which is the Public Health Research Programme, and it's under that in which PHIRST, the FIRST initiative, sits. Overall, the aim of the Public Health Research Programme is to fund research to generate evidence that's informing delivery of non-NHS interventions. So, as I alluded to in the last slide, so much research takes place in a very healthcare-focused setting, but the aim of the Public Health Research Programme is to broaden that scope, really. And so the outputs of it are intended to inform initiatives that improve the health of the public more widely and reduce health inequalities. And it's actually one of the strategic aims of the NIHR to build capacity in preventive and public health research. And the FIRST scheme is very much part of that. Next slide, please, Tracy. Great. So FIRST is an acronym, and it stands for Public Health Intervention Responsive Studies Teams. And in a nutshell, the initiative consists at the moment of 6 academic teams across the country, fully funded and ready and waiting to evaluate local authority initiatives. The mechanism is that local authorities can propose initiatives to evaluate, and those that are selected in a competitive process are then co-created. The evaluations, that is, are co-created in partnership with one of the FIRST teams and with the local authority. And the aim is to inform future decision making across local government, and obviously there'll be some mutual learning that's fostered at the same time. So one of my colleagues, Helen Walters, was instrumental really in setting up FIRST. She was a former director of public health in London and realised that what we needed to do was grow the evidence base for things that local authorities should and perhaps shouldn't be commissioning, and so FIRST is feeding into that agenda. Next slide, please, Tracy. So some examples of FIRST projects that are currently underway. So we've got 32 initiatives, local authority initiatives currently being evaluated, all at different stages. So FIRST was started in 2020, so we're starting to sort of move from that initial phase into perhaps more of a business as usual phase. So 32 initiatives currently on the books, and just to give a flavour of some examples of those local authority initiatives, so they're on the slide here. So evaluating a newly commissioned employability service in Scotland, management of public spaces in Gloucestershire. One of the evaluations is looking at provision of universal free school meals in schools in London. There's teams supporting resilience, health and well-being in primary schools, and that's being evaluated. Digital approach to supporting community welfare in the context of COVID in Essex. In Hertfordshire, a specialist behaviour change unit, and what's the contribution to local government, and in Wales, an exercise referral scheme. So that's just a flavour of some of the initiatives, which hopefully is apparent from that list can be pretty broad ranging in their scope. Next slide, please, Trace. Okay, so I promised we'd go into some of the practicalities, if you like, of how to apply, just to demystify the process for local authorities. So in a nutshell, if you go to the NIHR webpage, which carries the call for expressions of interest, from that page there's a link to the application form. The screenshot on there is that webpage that carries the call. Click on the link to the application form, and the application can be made in a system called MIS, which stands for Management Information System. And what we ask is that local authorities provide information which is a relatively concise summary of the initiative. So we just need the name of the local authority, contact details, a brief description of the initiative. So, you know, what's it about? What's the geographical location of it? Where's it up to in terms of its current status and timescales, and how is it currently funded and to what amount? And what are the anticipated impacts on public health, inequalities, and wider impacts? And that, in a nutshell, is essentially it in terms of applying, or to phrase that more strictly, just expressing an expression of interest. So thanks, Tracy. Next slide. In terms of applications, there are 2 application cycles per year at the moment. They close in January and September. So the current call closes. So in a sense, it's almost a rolling call with 2 drawdowns a year. The current call is going to close on the 12th of September. So still plenty of time until then. As I alluded to in the last slide, the expression of interest or applying is not intended to be a particularly onerous exercise at all. It's not equivalent to putting together a full grant application as in other walks of academia. It's a much briefer process than that. Local authorities are very welcome to submit more than one initiative. Worth saying that local authorities with projects already sitting within PHIRST are probably unlikely to be funded unless they're close to completion. We do take into consideration the geographical spread of the projects, in other words, of the local authorities that are applying. And in terms of what would be in remit, essentially any initiative that's expected to have an impact on the health of the local population, and we'd encourage joint applications as well between local authorities. Thanks, Tracy. So what happens next after an expression of interest is submitted and the call closes? So those expressions of interest are reviewed and prioritised by a committee, and that's coordinated by NIHR. We'll aim to communicate decisions within a few weeks of the call closing. For those local authorities that are successful, we'll make introductions, and then the local authority and the assigned PHIRST team can then arrange to meet. Worth saying at that point is we do need an evaluability assessment to take place, just to make sure that that an evaluation is actually possible and feasible and can go ahead. And if that's if the answer is a yes to that, then the project can proceed. Just to emphasise that if successful, the evaluation, which is led by the PHIRST team, will be funded by the NIHR, but it's very much a collaborative endeavour between the local authority and the PHIRST team. So done in partnership. And I think this is the last slide. Just some tips on applying. So as always with these things, try not to leave till the last minute. Ensure your local authority is on our drop-down menu on the application system. If it's not, do just drop us an email and we can sort it out. There's a word limit for each field on the application form. Actually, I think it's a character limit strictly. No need necessarily to max that out, but the better the information that you can put into the application form, the clearer it is, the better, so that we get a good understanding of what the initiative is. So yeah, just try to provide clear information on the funding, the timelines, and where the initiative's currently up to, and what the anticipated impact is on population health. So in other words, why is this a really good initiative to be evaluated? Why is it of high importance? And just make sure you've got sign off from the DPH as well. And I think that's the final slide. Yes, so that hopefully has covered the key points. Do visit that website for more information, which is on the slide, and you're also very welcome to email the NIHR Secretariat. The email address is also on the slide. So thank you. That's what I was going to say, but do feel free to fire any questions our way.
I think the thank you goes to you, James, for your clarity. Really much appreciated. Thank you so much. And we will make sure everybody gets a copy of your slides if that's okay with you, because they're very helpful. So it's over to everybody for questions, really. Let's hear a couple of questions. Do put them in chat and we'll pick them up. Or we'll, if somebody's got their hand up, I can see Rachel Anderson de Couves. And a second, anybody else with a question before I hear Rachel's? Anybody see anybody else? Okay, I can only see Rachel's hand at the moment. So Rachel, fire away your question in a couple of sentences and then we'll over to James.
A noisy laptop, so I'll be very quick. Rachel Anderson from the University of Liverpool, Department of Public Health. Just wondering at what stage of an intervention you encourage local authorities to apply. So obviously that just has an impact on the type of evaluation planned, whether it's from the planning and intervention stage or when intervention is already underway. Thanks.
Rachel. James.
Thanks. Good question. I think what it's worth saying at this point is I'm actually fairly new in post at NIHR myself. So I was what I might do is ask Maya to field some of these questions. She's been working on the FIRST programme a little longer than I have. So Maya, I wonder if you'd like to.
Yeah, sorry, Rachel, I really struggled to hear, but I think you were saying if the initiative was being planned or if it was already established. Is that right?
I think it was about, I don't want to repeat Rachel's question, but it's about at what stage would you consider, how far does a project need to be underway before it's appropriate to evaluate it, I think.
It can be in the beginning. Obviously, we need to have something to evaluate, and it could be that that the application comes in and you start working with the FIRST teams right from the onset of being built in. What we can do is if you get allocated, you're successful, you get allocated, we can stagger the start. So you might have been successful in this round that's just coming, but you know that your initiative is not going to be up and running enough to evaluate it until December, and then we can schedule the start of the evaluation at that point as well. The most important thing is that you have the funding in place, and the funding will run for the duration as well. I hope that answers the question.
Thank you. Hopefully that helped, Rachel. Yeah. Okay, so bring on the questions, please. We're lucky to have James and Maya with us. Any other thoughts?
I saw there was a question about how many. So we've been getting anything from 23 expression of interest up to 45 in one of the calls. We tend to fund or go on to, we don't fund them, so we tend to go on to evaluate up to 12 initiative. So that's sort of the rate of that.
Okay,
sorry,
thank you. Another one here from Michelle about what are the expected timescales for evaluations to be completed?
So I think initially the thoughts were that the evaluations would take around about a year. I think as the FIRST initiative has developed, we're finding that perhaps they're more like 18 months, but so I'd say probably somewhere between about 12 and 18 months. Maya, I think you agree, yeah.
Up to 18 months.
I see a question from Francis. Did you have your hand up?
Yes, I did, and then I thought I'll put it in the chat, but then I didn't get around to doing it quickly enough. I suppose when you're looking at with the evaluations, obviously thinking of your formative, and sometimes those things like doing evaluation frameworks and things like that, so people have got everything in place, they're collecting the data early doors, but it mightn't be that they want to evaluate it or be ready for evaluation at a later date. Is the support that you offer, would it be things like those small things like helping people put together evaluation frameworks for bigger, obviously larger scale projects, or is it actually conducting a full scale evaluation? I suppose what I'm asking is the support available from FIRST? Is some of that, advice and support that local authorities, because I know in my local, I provide that support to people, but obviously it's important to get in at early stages to help them know what data they need to collect in order to evaluate. Sometimes the timings, you know, to be there right the way through. I appreciate you've got to sort of define the time that you're involved, and sometimes so I'm just wondering, is that support for full-scale evaluations, or are there elements of support that are available at different stages for local authorities? Because I think that would really help people, because I know, as I say, from my experience, it's people not knowing, right, what do we need to have in place at this stage in order to be able to properly evaluate. Does that make sense?
It's a really good question. I'm going to say on a basic, yes. So it was set up to do the more robust evaluations. However, what we're also trying to do, this is a collaboration. So the FIRST teams are not going in and doing the evaluation for you. It is very much a collaboration with the local authorities and their team. They're also trying to actually embed this training and make sure that future you have the skills to do the evaluations. The product of what the evaluation is actually, we call it what the customer wants. So if it is help, this is something that can definitely be discussed. I would make it very clear in the application so that it's known up front, because it's something that will be good for both the committee, but also the teams to know, so they know what they're going into. But yes, it is sort of the heart of this is to try and embed learning as well.
Lovely, thank you. I can see Former's hand up.
Is it worth just chipping into that as well? So I think it is worth perhaps saying that the FIRST initiative as it stands at the moment isn't designed as such to sort of build research capacity at that kind of early stage within local authorities. There may well be other ways of doing that, but I guess in terms of at the early stages when local authorities are thinking about maybe putting in an evaluation, that's not necessarily the remit of FIRST. But if I've understood the question correctly, but by all means, drop us an email.
Okay, there's also an offer in the chat from Emma to actually chat informally to authorities before they put in an application if they'd like to, which is helpful. Thank you, Emma. So, Ifeoma, you've got a question. While you're asking it, you might want to look in the chat too and see Julie and Richard's questions, Maya and James. So, Ifeoma.
No problem. So mine wasn't a question, it was actually a response to that. So we had clearly identified that while FIRST sits, if you like, to one side with this service offer, that we actually know that one of the, if you like, areas where public health teams have asked for support to develop skills is around doing evaluations themselves. We're aware of that. And we hope as part of the hub that we'll be able to offer, if not teaching directly ourselves, but again, making the links and being able to signpost public health teams to where to go to get that support. So Nia and I are working in the background to find the right people to signpost you to, and I'm confident that that's quite a high priority for us. Thanks.
Lovely, thank you, Ifeoma. There's a question in the chat from Julie. I don't know if you can see that, Maya and James.
Yes, there is. So none of the initiatives that we are evaluating currently have finished yet, because it's still, as James said, we only started this in September 2020, and due to COVID, a lot of it's been delayed. They are coming out. The first should be coming out this summer. We have been working with the FIRST teams. They have setting up their own websites. It should be coming out in June, beginning of June, and you'll be able to see more of the evaluations there on our website. In that James put up, you can see with the links to some of the initiatives we mentioned. They're on our awards and funding webpage, so you can read the protocols of them and get a flavour of what they are. Richard's question about the health economics, the teams will have a health economic embedded into one of the researchers, so if that's what's required, that can be looked at as well.
Lovely, great, thank you so much. I think, can we all use the emojis and give a clap to James and Maya for their thought, help? Look, loads of them floating. Thank you so much. And we're going to go into breakout rooms now and have some conversations. James, Maya, are you going? Are you staying? Or
we can't stay for the breakout, I'm afraid.
No,
Many apologies, but yes, I hope that was useful. And as I say, our email address is on the slides. And,
lovely.
Do have a look at the PHIRST website. Incredibly
helpful, and thank you. And you've stimulated our conversation. So hope we meet again in the future. Thank you and goodbye. Thanks.
Thanks, everyone.
So we are going to move on to think about what this means for us and whether we're interested in taking up this great free co-designed offer that's waiting for us. So you're going to actually work in local authority areas if you work in public health, and if you're an academic, we'll mix you around the different groups, because we think it'd be a really good idea for you to actually respond. What do you think of this offer? And if you applied for an evaluation in your area, what would be the most useful thing for you and your teams? So you can see the slide in front of you here, self-explanatory question. You will have a facilitator in the room, so just check out that which authority you're actually in when you get in there. We might find that two authorities are combined. That's fine. If you're not in the right group for your local authority, that's okay too. Contribute, and then you'll hear what your group is thinking later on. So we'll do our best. But what makes it attractive to you to take up this offer? And importantly, just think about some of the areas that you might have up there now as possibilities for evaluation. You saw the list from James of sorts of things they've considered, but what are your ideas in your authority? Okay, and if you were going to apply, any further support that you need to do so. And we'd like, if you really are seriously considering one of these ideas, we'd like to hear it in the feedback too. So facilitator will introduce themselves. We'll give you just over 15 minutes, and we'll just ask for 1 minute feedback from each group, majoring on your evaluation ideas when you come back. Okay, so Ryan, if you're ready to send people out to rooms, that's going to be welcome back, everybody. Hopefully that was a really stimulating conversation for you. So we're going to have 1 minute feedback from each of the groups. So this is real headline stuff. So I'm going to start with Tara in Warrington. Tara, are you happy to go first? If you want to unmute yourself, if you could, Tara. Oh, I'm not hearing from Tara. Okay, maybe has Tara come back? If not Tara, let me go to Charlotte in Wirral. Are you here, Charlotte? If you unmute yourself.
Hey everyone, I'm Charlotte.
Lovely.
I'm healthcare public health consultant at NHSEI Northwest, and just to let you know what we discussed in our group. So I think the sort of offer around this was very sort of positively welcomed, and I think one of the main things that was discussed in terms of the attractiveness of the offer was almost that kind of range of expertise that it could bring, in terms of also capacity that might not otherwise be there. So I think it's just that opportunity to do what wouldn't otherwise be possible. I think in terms of ideas, I think certainly there were colleagues in our group that were thinking about this and thinking about specific ideas to hook into, but a bit more work to be done on that. And then also just in terms of that further support or maybe just some issues to think about. I think the issue of kind of the headspace almost to kind of stop and think around some of the ideas for this, we discussed. We discussed also that there is really that need to kind of get that message out about the opportunity, which hopefully today is doing a brilliant job in terms of that. And then two other issues, which was there's a need to just kind of manage the expectation, because I think if colleagues are putting in some of the thinking and some of the work around this, there's obviously an opportunity cost, isn't there, in terms of where time and attention is given. So it's just kind of managing the expectations around the kind of the likely success, etc. of that. And then the last issue was just that actually in terms of evaluation, sometimes there may be the issue that, for example, from a programme or service point of view, there's actually a very quick turnaround needed on some of this, and actually in terms of this process, just to kind of how, you know, kind of marrying up the alignment of those two things, really.
Lovely. Thank you very much, Charlotte, and the Wirral team, really very helpful. I'm going to go to Helen Bromley next from Cheshire West and Cheshire. Helen, could you just go straight in on any evaluation ideas you have, please? Just a minute.
Thanks, Mari. Can you hear me okay?
Yeah, perfect.
Okay. So we were a disparate, a small and eclectic group, and not many of us from Cheshire West. So that was interesting, and we had a discussion actually about some work which was refreshing our place plan for Cheshire West, which is a beast, if I'm honest. And it's our health and wellbeing strategy, so it's got statutory status as well. So I would be really interested in having a conversation with PHIRST around whether there was any potential for us to evaluate the impact of our place plan over the next couple of years, or parts of it, because it's big, it's very wide ranging, very much based on the marmot work that's been going on locally that people might be aware of, so probably too big for one evaluation project. So that was the main thing that we spoke about around evaluation ideas.
That's great. Thank you very much indeed, Helen. Do you mind if I go on, Helen, so I can include all the groups? Thank you so much. So I'd like to move to Tara Warrington. Are you with us?
Can you hear me now?
Yes, can do. Yes.
Okay.
Yeah.
So I'll try and be quick. Because we haven't got a strong R&D network within Warrington, we've got an NIHR funded person starting with us part-time on May the 9th, in order for us to progress that and to strengthen the links with academic colleagues. We thought we wanted more of an immersive culture within Warrington. So rather than going to academics when we've got a problem, I think Rosa made the point, you know, let's develop the solutions together, or the questions together. So how do we do that so that people are embedded within place? And the final point was, we did come up with some options. You know, we looked at perhaps the health and wellbeing hub that's part of the town deal as an evaluation project. But what we wanted to do is think about things that were coming up in the next 2 or 3 years that we might want to evaluate, rather than what's immediately in front of us. So we've got a plan to generate our submission to PHIRST, but we really were thinking much more about embedding R&D colleagues within our health and wellbeing board. So actually having a network that supports the place-based agenda. Sorry about the unmute.
Lovely. Thank you very much indeed, Tara. Rory, would you like to do, Richard, would you like to do Sefton? Or Rory's doing Sefton, is he?
Yeah. So I was actually the only one on from Sefton, so we were a bit of an eclectic mix as well in the group, but some really good discussion. And I'm aware we're short of time, so I'll give you the high-level notes. So everybody was quite positive about it, thought it was a really good opportunity, because it's funded as well, it was a huge bonus, and there's potential to use innovative technologies within the skill mix within PHIRST. And also in the current landscape with reducing budgets, it would be good to help us prioritise as local authority public health teams what we should and shouldn't be commissioning. In terms of the evaluation ideas, there was a consensus in the room that basically it's something we will have to go away and think about within our own teams, but there is some current opportunities perhaps nationally with the funding for drug treatment services, and if a formal evaluation could be done on that in a larger footprint, and also some of the smaller pieces of work that have come out of the pandemic that are more innovative, potential to do evaluations of that in a more holistic way. In terms of further support needed, there was an acknowledgement that health and economics and return on investment is perhaps something that's missing within the skill mix of the public health workforce, and also how we can establish relationships with the academic sector that has a lasting legacy, so that we can understand as well what the expectations are for local authority capacity and how closely we'd be working with academics within the evaluation space.
Lovely. Thank you very much indeed, Rory. Anybody, Richard, would you be happy to do Cheshire East and Knowsley and maybe just go in on evaluation ideas if that's possible?
Yeah, so in my group it was predominantly Cheshire East, but also Halton and myself from Knowsley.
Okay.
In terms of evaluation ideas, to be honest, there wasn't that many. I mean, it was all really, really positive discussion and stuff. We did talk, mention hardship, cost of living interventions, and that most local authorities are doing actions around that. So it'd be useful to do something where we're looking at the different approaches in each local authorities. And I think there was, because we had a collaborative group, it seemed to be that a discussion went down that it would be good to look at a few areas where we're doing things slightly differently, but with the same outcomes. We also looked at around population health outcomes. So a lot of public health teams don't the corporate team does the commissioning, but the public health teams are trying to use influence and system leadership stuff, and how do we measure the impact of population health outcomes for that. And then the final one was around the long-term health benefits of stuff around regeneration and the stuff that's going on around marmot and stuff like that. So I think they were the three main areas, but it was very much around we need to look at what can we do collectively between the different areas, because we're all doing things on the same areas of concern. Thanks.
Really very helpful. Thank you very much indeed, Richard. Nia, you were with Liverpool, I think.
Yes, but again, we didn't have anyone directly from Liverpool Public Health, so we had a bit of a mix of people. But we did have Emma Halliday from who's the Lilac First lead, which was very helpful. So obviously addressed the two of those sections about what she's offered this further support. In terms of evaluation ideas, obviously it was slightly different because they weren't directly in local authority. But the main things that came out the discussions was around community-based groups, as well as using physical activity or sport, and both of those were addressing low-level mental health. So either looking at this additional need for addressing low-level mental health post-COVID, and also looking at addressing mental health in young people and adults, which I think I understand there's some work already starting to happen there with the University of Chester. What was quite nice is we seem to be doing some quite nice networking in our group, which is what we're hoping from this hub. So that was nice. Also some discussions about inequalities in cancer screening in Liverpool.
Lovely, thank you, Nia. Okay, Ifeoma. So if you go, you're the final group. It'd be good to hear what the group said, but then afterwards, if you would sort of bring us to some conclusions from this session, if you like, before we have a break, that would be really helpful.
Yeah, so again, varied discussion, not everybody from Halton, but great opportunity to network. So there were sort of three main areas that we focused on or thought might be beneficial. So one of them, if you like, picked out the fact that bereavement services have changed as a result of COVID. Obviously not just locally, but across different local authorities, and these are an opportunity to do something bigger about that, as well as pre-bereavement support as well. So when you know that somebody's approaching the end of their life, what sort of support we're putting in before that, and could we look at that? More locally, we've got a support program for loneliness in older people. It's called Sure Start to Later Life. It does more than just loneliness. So there was a conversation about could we do some work on that? And then quite intriguingly, I think, anyway, there's a lot of talk about digital health. Again, COVID pushed us into that digital space more. And we're starting to talk about how we use this as part of our integration journey. And is there an opportunity, because it's so early on, to build in the correct metrics now in order to evaluate it? So we found a few that were interesting. More broadly, listening to some of the things that people have said, absolutely, as part of other discussions, I know we've picked up the work that's been done by the Marmot team and the fact that we need to tackle health inequalities. So there's an opportunity potentially there. I know even yesterday there was an exchange about how do we look at some of the interventions that have been suggested as part of the Marmot work around employment, and how do you know which of those interventions actually works. So there's opportunities I strongly feel around there. And then, of course, there's the innovation that's come out of COVID that individual public health teams would have seen happening. So I think, again, there's huge opportunity, again, to pick up and do some of this evaluation. Just to say something, though, about some of the extra support needed, there was slight nervousness in my group, and I know it will be echoed across other teams, that there's the suggestion that the first team, although there's the funding there to pick it up, may not necessarily do a proportion of that. I think we really do need to understand better from the first team, and this is something I will pick up and go away with. How much are they going to be involved in the evaluation? How much do they expect local teams to do? Because as ever, public health teams are under enormous pressure, and there are issues about capacity within our teams. I see Richard's raised his hand.
Richard, do you want to have the final word on this?
Yeah,
thank you very much, Palmer.
Yeah, just say that came up in our group, and about maybe it would act to exacerbate inequalities because there's different sizes of teams, expertise, and in terms of numbers, and that is problematic. So sometimes it's not that we don't want to do robust evaluation, we haven't got the time to put in the application. It sounded like it was quite straightforward, but even that is difficult. I also wanted just to add the other thing that we need, and that's some of that flexibility around the decision-making time and information around that. So if we're planning to do an intervention, waiting 6 months till September or till January doesn't always fit. And I know it's difficult from a research perspective. They want to do it in 2 panels, but it's not helpful for us locally. So if you can influence that, that'd be great. Thank you.
I think if you guys can't influence en masse, who can? Okay, sounds like it would be a good idea to have a break. So let's, if you don't mind, come back at 2:30. Do come back, do keep your screens on and don't go out of the breakout rooms. And when you come back, we're going to hear from Dr Jade Thai about potential collaborations, share some ideas that she's got about what might be possible for us. So we look forward to hearing from you, Jade, and speak to you all very soon. Have a drink, have a move around. I'm going to make a start, if that's okay.
Absolutely.
Yeah, let's go for it. So do put your cameras back on. That would be great to see as many faces as we can. Thank you all for your energy and your commitment so far. We have 1 hour left together, and we're going to spend 45 minutes of it thinking about a piece of collaborative research or pieces of collaborative research that you might want to do across Cheshire and Merseyside. And Dr Jade Thai is going to start us off thinking about that with some 10 minutes input. So Jade, would you like to just kick us straight off? Thank you.
Thank you for inviting. So I've titled my talk Creating Research Collaborations and Partnerships, because I believe this is what this session is, part of what this is all about. And also, Ifeoma asked me to highlight research that was, can you hear me?
Just about, Jade, I think.
Oh, is this better?
Yeah, that's better. And do say, I didn't say that you were from the Liverpool Health Partners, but I have now, but you might want to say a bit about that as well.
Yes. But I was saying that if Ifeoma asked me to give you a flavour of research that can be done relatively cheaply versus the bigger pieces of research that require some formal grant funding to be able to be achieved. So I'll introduce myself now. I'm the Neuroscience and Mental Health Programme Manager at Liverpool Health Partners. We are the academic science system for Cheshire and Merseyside. And so these are our partners as formally, but we work very broadly as well across the patch. So my job is to develop research collaborations and projects across our partners, but also involving local SMEs as well as hopefully local authorities. So I want to give you some examples of research that I've been supporting and collaborations I've created. Having been in post for the last 14 months, I'm very new to Liverpool. I'm enjoying it very much. So the research funding that can be done without any formal grant income. So Dr. Antonio da Costa approached me because he wanted to do a systematic literature review. And what they said, so there's no funding that is required for evidence synthesis, but there is the time and the people resources. So him and a group of his trainees are doing a systematic review with some input from me to provide free software that allows you to be able to share all of the papers that you identify for your systematic review and to enable you to be able to do a systematic review effectively and extract the information you need and develop a robust systematic review protocol that gets you the information you want, that would form the basis and evidence base to identify the research gaps and the questions for an actual research project that would come off the review. But importantly, the systematic review would then be published in a leading journal. So we would also tailor it to ensure that the systematic review was of the quality that was publishable, which then also helps you in your track record to be able to do to get a grant application. Another project from the Warrington Centre, Jo Howarth there, she contacted me and her team, Jackie, Isaac and Helen, and they wanted to produce a virtual reality educational tool, or a more sexy educational tool for young adults to teach them about the consequences of head injury, because they are physiotherapists and trauma therapists, and the age group that they see are young people sort of 16 to 18, early 20s, because these people are starting to go out in the world, be more active, starting to drive, etc., and are the likely ones to get an acquired brain injury that can have lifelong consequences for them and their family. So they want to create something that's educational and could potentially be preventative. So with a co-production hat in mind, I connected them with the City of Liverpool College students. They have a virtual reality suite. They do courses. And because obviously the team had no money to make this tool, but the City of Liverpool College have all the resources, and the students want to have real life, real world problem projects to do. So this was a match made in heaven, really, this collaboration. And it also meant that the students were the age group that the therapists want to target. So if that age group is making the educational tool, it will speak to their age group and hopefully be more effective. And then hopefully this will become probably an NIHR invention and innovation grant with the full research evaluation once the college and the clinical team have made a prototype. So during COVID, of course, schools were very much impacted. And as part of my work, I host the Mental Health Research Collaborative that has members from across the Northwest Coast. And I invited a deputy head teacher to come and speak to the group about the impact of COVID on children and young people in her school and on teachers. And out of that meeting, Edge Hill University, the creative therapists there, said they could help now. So they started an initiative where a therapist would come into the school one afternoon every week, and then their placement students would be able to work with some groups of students in order to help them with their mental health and well-being. This meant that the school got additional support immediately. This meant that the students at Edge Hill University who were taking the therapy courses got real-world placements. And then the research team could look at this as a feasibility study for lessons for research in creative therapies in schools during the pandemic recovery. And again, this was not formally funded, but it was something that will now become a much larger research project once we've now gathered this data and this experience from this collaboration. And of course, we've created this strong partnership between the university and the school. So this next example, I wanted to really highlight this example because many people may not have a formal research background. So, you know, I'm an academic by background. I did my PhD about 18 years ago. I've led research teams and been funded in various grants from charities to Medical Research Council. And part of my job, and one of the things most rewarding, is supervising my PhD students and creating the next generation of researchers. But you don't have to follow that formal pathway. So Victoria Furphy at Alder Hey Children's Hospital is the Chief Clinical Information Officer for the Community and Mental Health Division, but she's also a specialist speech and language therapist. And what they've research can come from anywhere. And really, it's most impactful when it comes from the patient. So there was an unmet patient need identified via the patients and the family feedback service that said that the children and young people in Liverpool and the Sefton area really struggled to gain quick and easy access to mental health services and support. So the team were able to get some funding from NHSX and NHS England to create a digital online platform for referrals across 9 mental health partnership services, which was quite a feat, but also to provide an index of professionally validated resources to support the family while they were waiting for their appointments. So this was only to fund the platform, but not the research or the evaluation of whether this digital platform and this solution actually did make a difference and improved things. So Vicky had never done any research before. She would never call herself a researcher. But in the NIHR, you don't have to be a full-blown academic and experience to be a lead applicant on applications, but you do need a strong research team behind you. And we linked her with Dr. Graham Smith from LJMU, and we were successful in getting a NIHR grant to do the research and evaluation and to further develop this digital platform to add additional gamification resources for the children. And this will be in co-production with the patients and families as well. So on to some bigger, more ambitious examples. So research doesn't necessarily have to be a project. It can be a partnership. So the MRC recognises this, and they have an MRC partnership scheme, which is to create a consortium, which you all might want to think about, that is to address a research need or theme, or to create a shared research resource. So for the last sort of 10 months, I have been putting together and supporting Professor Simon Keller to create this partnership, to create the world first life course neurobio resource. And this bio resource will include embedding research into the patient pathway. So patients having MRI scans, blood tests, surgical resections in neurosurgery, cerebral spine fluid taps for clinical purposes can also consent for this to be part of a research project. And we would link this data in collaboration with the Liverpool Civic Data Cooperative and the CIPHER team and a data analysis platform. This will mean that it's one of the most equitable ways for people to participate in research, because it's just embedded into their clinical pathway and they can just say yes or no. It's an ambitious project because it is live course, so we're going all the way from babies to aging population. And we have asked to this £2.2 million to be able to recruit the foundation sample for this biorepository. And then that data that we collect will be open to all researchers to apply, to have access to the data in order to then do their hypotheses-driven research. So this is an open resource for all researchers interested in neuroscience and mental health. without having then the funders having to pay for the collection of the data. So it's great added value for money. I'm sure you're all probably familiar with the smart COVID rapid antigen community testing that was done in Liverpool City region that was led by the University of Liverpool, the impact of which is the result of the will reveal insights that will help policymakers, public health teams and the public and the community approach COVID-19 testing, which we've all probably been directly impacted by the outcome of this research project. That was a really brilliant story that came out of the Liverpool City region and how the people of Liverpool really contributed to a policy making and decision making on the testing. So that's an example of, you know, the impact of public health research, what a massive impact it was. So more relevant to you is probably this funding stream, which is what James highlighted previously, what FIRST comes under, which is the NIHR Public Health Research Programme. So as he said, this programme is for research that generates evidence to inform the delivery of non-NHS interventions. So not the clinical trials as such or delivery of NHS services. And it's intended to improve the health of the public and reduce health inequalities. The primary aim is the evaluation of practical interventions which have the potential to deliver at scale in order to generate evidence to support public health decision making and to lead to substantial population level change. So they fund both primary research such as evaluation, but also preparatory research and secondary research such as evidence synthesis. So, you know, they also fund systematic reviews and scoping reviews as part of the stream. So it doesn't necessarily have to be a huge project. The funding stream has two types. It can be researcher-led, as in you come up with the research idea and you make the research proposal for your research idea. Or the public health research programme also highlight important issues to public health that they want to commission research in. So
just another couple of minutes, if that's okay, Jade.
The scope is multidisciplinary, and I've linked to the website there. I want to highlight some of the commissioned cores that we've been creating teams to support. So there was a commission call for effective interventions aimed at preventing domestic abuse, and that's led by Professor Nusrat Hussain at Mersey Care. There was a commissioned call for suicide prevention in high-risk groups for public health research. That's being led by Dr Pooja Sani at LJMU. And there is a call that opened in 2017 for promoting independence in older and disabled people, looking for the most effective interventions which support or create conditions for independence in everyday lives of older people or disabled people of any age. And so this is still an open, important priority to the programme. If anybody has any ideas, interventions in that and want to talk about it and see if I can support an application, please get in touch.
Lovely. Thank you so much, Jade. That sounded, well, I mean, mind-blowing actually in terms of the creativity, the opportunities and the huge people focus that everything was about people and impact and difference that you can make. So thank you. Can we give a great big load of clap? If everybody can do a clap. Yeah, lovely. You can see them all, the hands clapping. Thank you, Jade, so much. And I think you'll stay with us now and probably join a group, which will be very helpful. So last or second breakout session, again facilitated, and what we'd like you to think about in your breakout group this time is, given what you've heard from Jade, what sort of research questions might we focus on collaboratively across Cheshire and Merseyside? And we'd like each group to really come up with one research idea, one thing that you think we could all do together and commit to. And then once you've decided your one idea, frame it as a question. What is your question and why is it important to Cheshire and Merseyside? So you'll have a facilitator, 1 minute feedback when you come back, and then we'll see what the most popular idea is for potential collaboration. So Ryan, I think, is going to send us off into the groups. Everybody pouring into the room. If you're excited and got lots of thoughts, do write them in chat. This chat's been amazing today, actually. We're going to certainly copy it and send it round because there's so many contributions that are really helpful, volunteering ideas and thoughts. So thank you again to Jade. I don't know which group was lucky enough to have you, Jade. Which group were you in?
With Ifeoma and Abby and Gillian and Danny.
Okay, so let's start with that group then. If that was with Ifeoma, was it?
Yeah, it was. I was lucky enough to have her in my group. Really interesting discussion, and what we honed in on was looking at the linkages between physical activity and alcohol. We often hear about how physical activity is really good for people's well-being. So now there's how does physical activity support and enable people who are shall I say, misusing alcohol? How does it support them through intervention, but also prevent perhaps alcohol misuse as well? So it was a really interesting discussion we had, loads of opportunities and lots of people working in this field. And the great thing from our perspective is that CHAMPS also has both physical activity and alcohol as priorities. So I thought it was a really exciting possibility there.
Amazing, that was great, and thank you for the clarity of the feedback too, Ifeoma. So as you listen to these ideas that are going to come thick and fast in a minute, work out which one you think has got the most mileage, most legs in it, and we're going to have a vote at the end, or we're going to get you to say which your favourite is and then take stock. So thank you, Ifeoma. Helen, do you want to go next? What was your group?
Me?
Yeah, do. Helen Bromley, yeah, please.
There's usually too many Helens on the call, so I always have to clarify which Helen is you're speaking to. So we had a really interesting and wide-ranging discussion, but we didn't really get much further than the first question, I'm afraid. So we identified several themes that we thought had merit. One was around, so this is about ideas to focus on, your research ideas. One was about marmot stuff. / inequalities. One was about looking at place-based working and what difference that makes. One was about evaluating the national drug strategy money that's coming down to local authorities, where there seems to be money coming down, but there doesn't seem to be a lot being said about how it's going to be evaluated. Another area for a research idea was community-based mental health support / counselling in the presence of these long IACT waiting lists. A really interesting one I thought was getting money into the third sector and following that money through, seeing how effective it is. So Marmot makes mention of how good the third sector is, but I don't know what evidence we've got around that. And then very quickly, the last couple, one was around evaluating or reviewing our approaches to identifying priorities and programmes across the patch. And then finally, some kind of, I don't know if it's research or position piece, but feedback to NIHR on their approach, because quite often their approach is very clinical, less so now than it has been. But in terms of real world research evaluation, when you're doing natural experiments and action research, that doesn't always land well with NIHR. So there's something about how we feed that back.
Lovely, thank you, Helen. Any that you'd just put your money on there, a favourite or not?
I've got a favourite, but I don't want to speak for the group.
Oh, go on.
Have different favourites.
Go on, what's your favourite? We'll go with that.
My money would be Marmot.
Marmot, okay, thank you. Brilliant. Okay, thank you to Helen and the group. Wide-ranging thoughts there. Richard, would you like to go next?
Yeah, I can be brief. Marmot.
Again. Oh, right.
Correct answer.
We went down the route of we basically just went to that first and then didn't move off that. So I think the challenge, so reducing health inequalities through the Marmot work, I think we had difficulties getting to a specific research question, because obviously although some of us like myself, have seen the report with the recommendations without going through each of them and looking at which ones we would look at, because there was focus on, there was recognition that it can't be the whole programme because it's too broad, too wide, too many partners. So we need to look at the specifics. But some things that we picked up around the research question would be differential impacts of the Marmot Communities Programme on different inequality groups, the need to focus on a specific intervention, so for example, either child poverty, best start to life, or whatever it might be. And the reason that we thought that was beneficial for Cheshire and Merseyside is we're all 9 areas are bought into that already. We've got the Marmot teams here for the next 2 years, so it's a good opportunity to link with them, use their expertise. We've got indicator sets, etc. Yeah, and inequalities is just massive. So there you go. I'll finish there. Thank you.
Yeah, that was great. Thank you, Richard. So 2 Marmots here. Right. Okay. So let's go to Nia and Charlotte. Nia, are you going to feedback? I think you were a combined team.
Yeah, we were. I think we combined after a few minutes. So yeah, again, we were a bit of a mixed group. I think mostly academics and researchers. So Paul Kingston told us a little bit about Petra, which was looking at post-Brexit, looking at the trade agreements and how they might compromise food or sort of diet quality, which, although it might not be a specific research question here, made me think that actually it can be really broad and how interdisciplinary these research questions can be. I guess for me, the main headline was, in terms of our suggestion, was kind of turning it on its head a bit, because we had Greg Woodley from the NIHR suggesting that another approach is to present the health inequality data and feed that back at a ward level, and then get the community members to come up with these research questions themselves and where they think is that the priority should be. So I think that's a really nice suggestion. I don't know if Charlotte had anything to add.
Yeah, just that clear link with Marmot again.
Clear link with Marmot. Thank you, Charlotte, and thank you, Nia. So clear link with Marmot there, but yeah, you've turned the question on its head a bit. That's a challenge for us. Thank you. So, Rory, do you want to go next?
Yeah, no surprise, Marmot again. I think what we were talking about, though, was theoretically about health inequalities generally, and how it's more of a up the range of discussion now between all sectors and the public, and more awareness. But potentially we're still not communicating the same problems amongst different populations. So something about, is awareness being raised properly in the way that we would think that people would like to know about? But also the 2 years dedicated support that we have from the Marmot team currently, and it would be good to build upon that, but also to connect the dots with the ICS strategy as well, and the reforms going on within the NHS, and really look at health inequalities as a whole. So we actually tried to drill that down to a research question, and as Richard said, it's so broad. But what we were trying to think about was there's a lot of individual pieces working on across the 9 places within health inequalities work that is umbrellaed within the Marmot work. So it would be good to have a feel for, would there be a way to understand the common beneficial outcomes and a standardized approach for these pieces of work going on across the 9 places, because it can be quite difficult to know what is working and what mightn't work as well outside of Cheshire and Merseyside, or what might resonate more with our local populations. So then we went a step further and thought one of the real positive outcomes from a piece of work of that, like that, would be a tool that could be developed that could show you, like a Cheshire and Merseyside inequalities tool, that what works and what didn't work. And we felt that that was important for Cheshire and Merseyside to have a lot of participation from communities, really, and having them be in the room and helping shape some of that tool development work and understanding the impacts of the health inequalities research.
Interesting, isn't it? Everybody's taking a slightly different perspective on potentially Marmot. Okay, so Tara, do you want to go last on behalf of your group? I don't know if we can't hear you, Tara. Are you still with us? Anybody else in Tara's group who would speak on your behalf? Oh, I can see you, Tara. Can you can't get to we can't hear you, can we? Somebody else in Tara's group, because she can't get sound. Anybody? Oh, never mind. I think we're going to go quiet. What we're going to do...
She has added a comment. Sorry, Mary.
Has she? Okay. Imama as well. Okay. So, given what you've heard, do you want to just put down everybody in chat? What's your favourite idea there? I think Marmot seems to be jumping out, but any specific area of Marmot, or anything idea that you've heard that grabs you? Just write it down so that we can then digest that and start to think about what a collaborative piece of research might look like. And as we do that, we'll be looking and reading, and I think Ifeoma's going to summarise for us what she thinks the most popular idea is, or most popular specific idea is. Not going to be easy, that, is it, Ifeoma, to summarise that?
So while people are sort of typing in the sidebar, I'll sort of, if you like, come back to what I've heard. Jade started off by telling us about pieces of work that you can do almost for free. So one of the things that I know we talk about in our public health team a lot is pieces of work that we've done, or quite often we're quite lucky in Halton. We get foundation year 2 doctors joining us, and we'll often say, what's the evidence base for this? Go and find the evidence base for that. And occasionally they will perform systematic reviews. So now hearing that there's an opportunity to perhaps work more closely with our academic partners, a systematic review is a very easy way that public health teams can quickly pull together evidence. The other thing, though, that I heard is that there's some quite interesting innovation out there. I loved it, that word gamification. I liked the idea of the school's lessons plans, and certainly the life course approach to research as well. Our public health teams are seeing people every day in different situations. Is there an opportunity to start to create and think about some life course approach in some of the interventions that we deliver in public health teams? So that's what I heard when Jade was speaking, and sort of what sparked my thinking. And then I have to say that the group that I sat with, the first thing they said was Mama, and I said, great, Mama. It's big, it's too big. Let's try and get a little bit more focus on this Mama elephant that we've got. And maybe it was pure luck, but two of the people in my group had alcohol as research interests, if you like, and one person was more interested in physical activity, and yet there was clearly links between the two and some ongoing work. And it was just a really, I mean, I wish you were all in my group. It was such an interesting discussion. On to Marmot. So Marmot, there's a lot of interventions and work taking place. There's lots of discussions taking place within public health teams already about Marmot. And certainly it's sensible to go where the interest lies and where the opportunity lies. There's indicators being developed that could certainly support ongoing research. I think if we were collectively to pick and choose, for example, Marmot, we'd have to really hone down in. The first workshop that we had, it was quite interesting that there was a real push and willingness for us to really start to reach out to the public. So when Rory was talking about the Marmot approach, and to a degree Richard as well, I thought, yes, there's certainly really some potential in those suggestions. Today isn't about us saying we're absolutely going to do this. Today was really about exploring the art of the possible. We're going to meet together at various times and hopefully have the opportunity to shape this further. And the hub, as I say, should have the opportunity to share information, and we hope to do that both by having information on the website for you to come to, that will be hosted on the CHAMPS website, but we'll also have, as you know, regular communication from CHAMPS that will go out to you, which will give you additional information. We hope to be able to invite you to additional training events, CPD events. We hope to be able to offer you potential support if you do want to do research in your local areas. We're exploring some offers that we've had from academic partners to actually enable you do both research and evaluation back at the ranch, as I like to call it when I'm referring to my local place. So I hope that's a sort of a useful summary of sort of where we are at the moment. Mari, have I missed anything? Is there anything else you want me to say at this point?
Not at all, Ifeoma. I think you've covered it all. I mean, it just sounds overall to me like there's a big commitment to doing collaborative work and a lot of excitement, but also a lot of creativity, as always in Cheshire and Merseyside, which is great. And thank you for stimulating that, Jade. Okay, so I think we're coming to a close. So what would be helpful, you've really used the chat here. It's been great in terms of connections. Rarely see as much chat going on. So final chat, if public health colleagues might like to just give us a commitment really about how they might use research and evaluation in your roles when you go back into or return tomorrow. And I suppose that's about what have you taken away from today really that's stimulated you? How are you going to use this? And for our academic colleagues, great, really good to have the two of us joined here. How could you link differently and better, do you think, with your colleagues in public health? What have you taken from today? So if you could put that in chat, that's going to be so helpful, I think, for Ifeoma and Nia taking this forward with you all in terms of where you're at and what you can commit to. So literally just whack down a few thoughts, that would be great. It's always quiet for a minute while everybody types and things. Here we go. So let's read each other's as we go through. Thank you, Sharon. Again, offers here of help. Offers from Jade. Thank you, Jade. Intellectual speed dating. Great. Well, keep those coming as we go through. They're still coming in. Ifeoma, do you want any other closing comments, or do you feel that you're going to have a couple? Yeah.
So I suppose that the final burning question is, how do you get onto the hub? How do you get onto get us into this hub already? So the hub, as I've said, will be pretty much a virtual space, but we do hope to back that up by having a number of meetings over the year. Depending on how things work out, they may be online, or we may actually get to meet face to face. The key thing, though, is that we will send out an email inviting you to join the hub. The reason for doing this is in order to ensure that it complies with GDPR, so that we can hold your details and communicate out with you. So look out for that email in the next few days. The second thing that you will start to see is information, providing you want to join the hub, coming out to you, signposting you precisely where the information will be. I'm answering Andrew's question, and that's going to be hosted on the CHAMPS website. And so we will send that information directing you. And hopefully the first thing you will see is actually the report from today, and perhaps the slides as well. So I think that answers most of the questions that I imagine you will have about the hub. And I really just think that there's so much more that we want to bring. And a lot of the information that you provided today we will ensure that we look at that and ensure then that the hub's, if you like, a repository for much of what you want to see. So I think really it's at this point that I say to you, thank you all so much for attending, and really look forward to collaborating with you all more through research. Thank you.
Thank you, Ifeoma. And as Ifeoma said, thank you so much to you all for coming. Thank you to Jade, James and Maya as well for stimulating the thinking and sparing their time to be with us. Let's give them all a clap for that. Thank you. Really like to thank all the facilitators. It's a big ask, isn't it? You know, you've worked all morning and then you have to really, you know, focus and concentrate with a group. So thank you for working with the groups, all of you. And thank you to Ifeoma and Nia. They spent many hours planning this session, and you know they are almost the think tank behind this session today and behind the hub. So thank you all. And finally, we couldn't end really without thanking the team behind the scenes, and I think that's Tracy and Helen, who've worked for many hours to get us to today, but also Ryan, who's carried the breakout room thinking, and thank you very much indeed, Ryan, Tracy and Helen, and a clap, as you can see from us, for that. And just one thing we'd like to do in the last 2 minutes, Ryan's given us just 3 words to describe. This is Mentimeter. Think of the 3 words that describe today for you, and in chat Ryan has put a link to Mentimeter. Click on that link on your phone if that's possible. Is that how it works, Ryan?
Yeah, so you can click on the link that I've just put in the chat, or you can go on your laptop or on your phone to www.menti.com and type in the code that's now at the top of the screen, and then that should let you start. Yeah, here we go. The words will start coming through, and this will fill up our word cloud. So it's 3 words how you would describe today.
This will inspire us before we go away.
Sorry, while people are typing that in, can I also please thank Mari, both for the support she did behind the scenes in terms of getting us into the shape that we are today and developing this agenda and this workshop, her facilitation today. Thank you so much, Mari.
Pleasure. I love working with you guys, as you know. Look at all those amazing words. It gets smaller, that's the thing, as everybody comes in. Thank you, Ifeoma. Thanks for Jade here, you'll notice. Great. Are they still coming, or is that it, do you think? So we'll take this word cloud away and we'll carry it in our minds and inspire us. So thank you all. I think we're ending the session now, aren't we? We will save the chat. We won't flick out. We'll save the recording, and they'll all be available on the website through Tracy. Thank you, Tracy.